Good morning, everyone. My name is Jiwan. Today, I'm gonna present about my culture paper examining how cultural health beliefs shape the healthcare utilization among the East Asian immigrants in the United States. So, in this presentation, I'm gonna explore how their cultural values, the intergenerational trauma, and other social determinants of health influence their utilization of mental services and preventive healthcare services and like that. I'm gonna also discuss about how the DNP prepared nurses can apply transcultural nursing frameworks also to address these disparities. By the end of this presentation, we'll be able to analyze how the values, the cultural values, intergenerational trauma, and other language barriers or factors affecting the healthcare behaviors. Also, we're gonna examine also the social determinants of health and disparities in preventive and mental health services use within the East Asians, and also evaluate the interventions that promote equitable healthcare delivery for East Asian immigrants communities. East Asian immigrants are one of the rapidly growing U.S. populations, and although like some of them are already socioeconomically success, but still there are a lot of healthcare disparity exists within that group. Um, so we have to understand how their culture, migration history, and structural determinants like affect their utilization of the healthcare system. According to the research, 24 millions of Asian Americans living in the United States, and out of them, 35 to 40% are East Asians. Main reason for migration is the education, seeking for the new employment, and to be with the family, to avoid conflict or persecution. So this growing population also cut the needs of why there should be an improvement in a culturally responsive care. So what are the factors influencing utilization of a healthcare access among East Asian groups? First is the language barrier. So the limited English proficiency, of course, it remains one of the most significant barriers, especially for the older immigrants. So when the family members they serve as interpreters, the confidentiality may be compromised, and the non-medical information may be some lost. In addition to that, indirect communication styles and deference to authority may also like prevent the patients from questioning about their like concerns, and also like expressing their thoughts and like that. So as a result, it might causing a misunderstanding or miscommunication between the patients and the providers. Sometimes it also leads to a misdiagnosis as well. Cultural values and collectivism. So East Asians mostly are collectivisms, which means they value the group, the family, rather than individualisms. So healthcare decisions are often also made collectively as a respect of elder adults because they're the center of the decisions. Also for traditional gender expectations, like the man or the father should be like strong. They should not be sick. Like they have a lot of big responsibilities. It also discourages of them like expressing their vulnerability and their illness, which actually causing a delay in care seeking as well. For religious and spiritual influences, because there's still like old traditional practices performed mostly also in China and Korea, like 50% of them are unaffiliated, but some are like Christianity with Buddhism. Use of traditional herbal medicines, like, and also other modal interventions like acupuncture, like that. That one also like delay in seeking medical care for the especially for the older adults. Intergenerational trauma and discrimination. So many East Asian immigrants they have lived through the war, displacement, or political instability. For example, like Korean War survivors, they often adopted like emotional suppression as a survival mechanism. So like when there is a traumatic experiences are not really like open to discuss, the silence becomes a coping strategy for them, and the problem is it passed down to the generations. So like the younger generations, the children, they may also internalize the belief that emotional distress should be like kept indoor, and should be like kept in silence secretly or privately rather than like discussing open or treated professionally. This actually contributes to the mental health stigma and reluctance to seek for counseling or psychiatric services. Social discrimination also part of the factors that causing, especially after the COVID, because after the COVID, because they believe that it started from the China, the discrimination actually became bigger, especially in the healthcare settings as well. Other factors like social determinants of health, they also play an important role. Why like why suppressing or why causing a delay in disparities, the East Asian immigrants seeking for the right care of the treatment. These are the language barriers and health literacy, income inequality, insurance and unemployment as well, and also the immigration status affecting their access. Some of them are also worried to see the doctors or the healthcare, like because they have to show their valid ID and then a passport if they have some problems with that. So Geiger and David Heiser's transcultural assessment model provides a structured framework for controlling congruent care. So it has a six cultural phenomenons, like which are the communication, space, social organization, time orientation, and environmental control and a biological variation. So what makes this model valuable for this is that it has an emphasis on the individual variation, even though they are coming from with the same groups, which helps preventing stereotyping and the bias that happening there. So for example, like communication, they address the language preference and indirect expression. Social organization examines also family hierarchy in decision making. As what I've said, usually the East Asian, the center of the decision is the father or the head of the family, could be the grandpa. Environmental control explores about the beliefs about the faith versus biomedical causations. Biological variation also considers like potential genetic prepositions to certain diseases. So at the DMP level, this model guides systematic assessment and informs culturally responsive interventions at the both clinical and organizational levels. So when apply this in a real practice, this model encourages providers to actively involve the family with the consent, but of course while maintaining confidentiality of the patient. Also, we have to like value their traditional remedies and beliefs, but of course we have to like maintain the evidence-based care, and also we have to ask for them about the communication preference, and also promotes individualized care rather than assumptions based on the ethnicity, so that the holistic cultural assessments can be met and improve the outcomes. For the DMP level cultural competence strategies, so for the DMP level, it extends beyond the patient interactions, which means that DMP prepared nurses can lead quality improvement initiatives addressing the disparities in preventing screening rates, advocate for institutional interpreter services, and develop culturally responsive training programs. So this system level leadership is also essential to reduce structural inequities. So in conclusion, we can say that the healthcare utilization among the East Asian immigrants is truly like shaped by a complex interaction of collective values, their language barriers, traumatic history, discriminations, and other social structural determinants. So understanding these factors with the using of transcultural assessment model will allow the advanced practice nurses to provide equitable and culturally congruent care. For the future implications, we need more disaggregated data to be making more narrow to get a more accurate data, and also need some community-based participatory research as well. Thank you.